We are going to learn few things about women and epilepsy. Epilepsy in general and particularly in women faces a challenging problem for the treating physician as well as uh, when it comes to the patient and their family itself, because women as such, if you say, they are physiologically different from men because they have different patterns at different age group, and important is they have a lot of hormonal changes which comes up. Like say we'll take step by step, like a child gets a epilepsy, same it is treated as how a male is treated, but as the female child grows, when she reaches menarche, that's at the onset of puberty, lot of issues do start in, like a child who is taking certain types of drugs, medicine for epilepsy, it can delay the onset of menses, it can make the menses irregular, as well as the female child can have lot of physical problems like weight gain, hair loss, or growth of the hairs are the issues. Simultaneously, once this menarche starts, some epilepsy can start during this time, or if you see during the menses the seizure activity can go up, like what we call as catamenial epilepsy. So during this period we have to take care because of the hormonal changes which the female child is undergoing. We have to not only adjust the dose, but we have to choose the right medicine. Say for example, a female taking sodium valproate, there is increased risk of menstrual irregularities, anovulatory cycles, obesity, hair loss, and not only this, the subsequent psychological issues which these females face in. This is one example I have given. So as a doctor, as a neurologist, we always take care about these issues which this female child faces. That is one thing. Second thing is, as the child grows, the female child grows, then what are the issues which comes? The marriageable age. During the marriage, or obviously a lot of people do come in whether we should get married or not, whether we should tell whether we have epilepsy to the bridegroom. Those issues will come. We are not going to discuss on that today, but definitely a patient with epilepsy can go in for a marriage. But here the issues of fertility, conception, then preconception counseling, what oral contraceptives has to be taken, and important is how to manage the pregnancy. Coming to the approach, say for example, female gets married. Now the issue comes, what are the likelihood of this female getting pregnant? Whether these drugs which they are taking for pregnancy, are they going to hamper in conception? Few of the drugs, yes. Say for example, same sodium valproate, if we give, there is an increased risk of polycystic ovarian disease and ovulatory cycles. So there may be problem with the irregularity of menses, and because of that there may be issue about fertility. But if somebody doesn't want to conceive, then what oral contraceptives have to be taken? Because there are 4-5 medications which we give in epilepsy, they enhances the metabolism of oral contraceptives. We have to see, if we know about this, then we can, there can be a failed oral contraceptives, like almost 6 to 8% chances that a person who is consuming oral contraceptives may conceive, that's a failure of the drug, because the metabolism of oral contraceptives have been increased by the anti-epileptic drugs. That's number one. Second thing is, oral contraceptives, when we take, say, a drug called as lamotrigine, their drug level drops. If their drug level drops, then there are increased risk of seizures. Then we may have to increase the dose of lamotrigine. Second thing is, because of the anti-epileptic, sometimes they may forget taking oral contraceptives. So one has to keep a watch on that. Somebody else has to remind that they have to consume oral contraceptive when they don't want to conceive. That's one thing. Second thing is, when it is decided that they want to go in for a family life, plan a pregnancy, yes, they can go, but the counseling is very important. We always check on that. How good is the control of seizures? What are the drugs she is on? Whether the dose is adequate, number of drugs. Because if you see, if the female is consuming more than 2 drugs, the chances of having a seizure are very high, because they are taking 2 to 3 drugs because their seizures are not getting controlled. That's number one issue. Number two, the chances of congenital malformations, that is the defect which can occur in the baby during intrauterine period, what we call as major congenital malformations, and sometimes neural tube defects. See, normally also congenital malformation do occur in about 1 or 2% of the patient, but when they are consuming these drugs, the chances increases significantly by 5 to 6%, depending upon the drugs taken, number of drugs, and their dosage. Say if the person is taking 2 or more than 2 drugs, then the chances can increase up to 8 to 16%. So what we always plan, if the seizures are better controlled, we always try to decrease the dosage, or we can switch to a drug which causes less of major congenital malformations like levetiracetam, lamotrigine, where the chances of congenital malformations are very less. And once it is decided that they are going to plan a baby, then we always give folic acid as a supplement, which decreases the neural tube defects. Whatever drug she is on, we always supplement with folic acid so that the risk decreases. That's number one. Number two, we try and decrease the number of dose, maintain the dose. Then we keep on monitoring the drug levels during the pregnancy, particularly in the second trimester, where there are a lot of hormonal changes which comes up, the fluid level goes up, the weight increases. So we have to adjust the dose during pregnancy, and we do high risk ultrasounds, we do amniotic fluid analysis if wherever it is required, so that the neural tube defects can be detected early. And during pregnancy, the chances of seizures can go up, but we always try to maintain the dose. And most important is, we have to see that the sleep is maintained very nicely. They sleep adequately to decrease the risk of seizures. And obviously, once the date of delivery comes in, we have to see that we give injection vitamin K so that the risk of hemorrhage in the baby is decreased. And during delivery, it should always be a hospital delivery. Always the gynecologist, the obstetrician who is taking care of her during this period should be doing all the workup, so that a teamwork is drawn. The gynecology obstetric side plus the neurologist, anesthetist, so that all the sequence is uneventful. Once the delivery is done, many people, they do ask question whether we can breastfeed the baby or not. We always encourage breastfed to these babies, because unless the baby is premature, some of the drugs which we were giving, like phenobarbital, which goes into the breast milk and causes increased sedation in the baby, otherwise there is no problem. You can always breastfeed. So these are the few issues which always come up with women and epilepsy, and it is, if it is approached properly, the challenges can be met. But if it's not taken care of, then definitely the things can be a really a challenge, not only during pregnancy and during delivery. Why I wanted to speak on this women with epilepsy is, in our country, particularly in India, lot of myths are there about epilepsy. But if everything is planned according to the doctors, things can be taken care of. Thank you so much. If you see an elderly suffering from epilepsy, again the issues are very challenging, because if you see the elderly, lot of comorbidity. I mean elderly means beyond 60 years of age. Like patient who is beyond 60 years, many of them are suffering from hypertension, diabetes, heart disease, lung disease, heart failures, and on an average beyond 60 years, most of the individuals, they take on an average 7 to 8 medications for their what do you call it, survival and secondary prevention. And on top of it, if a person suffers from seizure and epilepsy, when we have to give medicines to this individuals, what are the challenges which we face? Number one, drug interactions. So many drugs which are giving, you add another medications, there are drug interactions. Either they enhance the activity, increases the level, or predominantly they can decrease the level. Not only this anti-epileptic drug itself can decrease the effectiveness of the medications which the elderly is taking. That's number one. Number two, elderly people, they do suffer from some amount of memory problems, and anti-epileptic drugs do have a memory dysfunctioning property. They impair the memory in this. Such, we have to find out that what best we can give to these people so that the minimum memory dysfunction is there. Number two. Number three, they have the tendency to fall. Anti-epileptic drug do cause instability in gait also. So that we have to monitor the drug level, and also every time when they come, we always establish that their gait is better, their memory is functioning fine, their drug interaction, particularly cardiac drugs and anticoagulant drugs, where the effectiveness of this drug can decrease in such cases. And definitely we always believe that go in for a single drug monotherapy which can have the best effect, not only control the disease, minimum interaction with other drugs which the patient is already taken. Number four, minimum memory impairment. Number five, obviously because elderly people do suffer from depression and low in their because of the social interactions are minimum. So we also give certain medications, like say for example lamotrigine, where not only the minimum effect of it is there on the memory, plus they have mood stabilizing property also, and it is safe in various diseases which the elderly patient suffer. Thank you.